why are girls underdiagnosed? Clinics report that women are being diagnosed more often than girls. In fact, in clinics, it's 1-to-1 men to women. And women self-refer. But the ratio of boys to girls being diagnosed in clinics is still about 4-to-1. So that means that we're still missing a lot of girls. And that's obviously a problem. And here are some of the reasons why. ADHD is a product of its history. In the beginning of the last century, parents were struggling to manage hyperactive, impulsive children. Unmanageable girls in the Victorian age were a source of shame, and they were not taken to clinics. And predominantly, young white boys were referred to clinics. And studies analyzed this clinic data, and diagnostic criteria based on this research is what became what's in our DSM, the Diagnostic and Statistical Manual that we use to diagnose. But it described really hyperactive young boys. And so our knowledge of girls with ADD was based on the girls who looked most like hyperactive boys, since they were the only ones who could be diagnosed. Even today's research includes only those diagnosed by the recent criteria, which is still on symptoms that are easily observed and categorized. And many rating scales are still skewed towards activity level and observable symptoms. And we really need self-report scales to get at the more internalized symptoms. And research suggests that there is still a bias in terms of the more inattentive girls being less disruptive and so less likely to be referred. And as a result, girls are still significantly underrepresented in the literature. They're about 2% of the focus of ADD research, even though they're 50% of the population. It's a pretty scary statistic. And today, for many, ADHD still means hyperactivity or learning problems. So they aren't thinking about what an inattentive girl might look like. So there are some unique factors that make girls' experience completely different. And the first one is really not well known at all, the importance of estrogen. Estrogen is a hormone that affects cognition and mood and sleep. And the brain is one of the target organs for it. And the symptoms that girls experience are, they really blossom when estrogen starts coming into their systems. So they appear less symptomatic in elementary school, and as they approach puberty, you see more and more symptoms. But up until about a year and a half ago, the diagnosis had an age 7 cutoff criteria. If you didn't show symptoms by age 7, you wouldn't be diagnosed. And most girls did not show symptoms that early and hence could not be diagnosed. So whereas boys' symptoms tend to decrease towards puberty and they become sort of less hyperactive, not that all boys are hyperactive, girls' symptoms just start really blossoming around puberty, and by age 15, 16, you really start seeing the symptoms. So it's very hard for, even now the cutoff has been changed to age 12, and it still eliminates a lot of girls, especially the ones who compensate the best, which is not to say that they suffer the least. And there's greater emotional reactivity when estrogen is low. So when you have fluctuating levels, as all females do throughout the month, and during the PMS week when it's very low, it wreaks havoc with their ability to self-regulate, and they look highly symptomatic and very moody. And so this is something that most people are not aware of, and it's a huge piece of the picture of ADD symptoms for girls, and obviously not for boys. In addition, there is the general likelihood that girls are more likely to have the inattentive type of ADD, which was not even considered as a possibility until 1980. And they don't look overtly symptomatic in ways that are distressing to others, so it just doesn't attract the same kind of attention. Then there's the piece about societal expectations, which are so different for girls. At a very early age, girls begin to internalize the demands of society, which still supports the feminine obligations to accommodate others' needs and be passively compliant and to be cooperative and to be neat and organized. And most girls feel compelled to strive for these ideals, even though they call upon just the executive functions that perform so unreliably in the ADHD brain. So they're really poorly wired for these things, and yet they feel terrible about themselves if they can't conform. In addition, girls, far more than boys, for girls, peer interactions are really powerful determinants of their self-worth. ADD makes it difficult for them to comply with the unique demands of girls' relationships. So missing a subtle social cue or losing track of a fast-paced conversation can result in harsh negative feedback. And while boys often externalize their frustrations, girls, craving social acceptance, try to hide their differences and appear to conform. And this becomes almost an obsession in terms of hiding. And they internalize their feelings because it's part of hiding. No one will know about this, and it's the defense mechanism of choice to keep their confusion and their shame a secret. So for most girls, there's constant anxiety about being judged as inadequate and fearful of rejection. And there's a lot of depressive feelings when they perceive themselves as underachievers. And it is demoralizing to work so much harder for so much longer to have less success than their peers. The research says that problems with peers and chronic peer rejection increases the risk for future problems, and especially low self-esteem. And what we're finding is that negative outcomes for girls are much more serious than for boys. And we're finding that degree to which they engage in self-harm and suicide attempts is far greater than for boys or for girls without ADD. Maybe for self-harm 5 times control girls, and suicide attempts 4 times the control girls. So those are numbers that can't be ignored, and we're trying to understand why that is. Some of the newest research, just a couple of months old, says that girls who have been exposed to early chronic trauma, so meaning neglect over a period of time or any kind of abuse, are at a greater risk for self-injury, eating disorders, and suicidality than those who are not mistreated. And by adolescence, 1/4 of those girls with ADD will report having some further kind of trauma versus only 11% of the control girls. So we're finding out that that environmental factors like socially adverse conditions can influence the neurobiology. So this is, yet another piece that we have never factored in, but we're going to factor in now. Okay, so girls also have a pattern of impairments that's really quite different than boys. when many people think of problems with school when they think of ADD, and they worry about school achievement. But the reality is that it affects every possible aspect of life, and there are much greater psychological risks that come with ADD. And there are a lot of physiological things happening inside girls' bodies that are impossible for them to ignore. And they have to contend with those before they can even begin to process information from the external environment. So it's only now that emotional reactivity is being considered a core symptom of ADD. Before, the impairments due to ADD were considered cognitive impairments. And if there were issues with mood and emotionality, that was considered part of some other kinds of problems, and girls were often identified as having those other kinds of problems. But now we're finding that that is not just a symptom, it's one of the core symptoms. And for girls, but not boys, there is the added volatility from the fluctuating hormone levels that I discussed. So girls can be both hypersensitive, and which is not the same as saying too sensitive. It's just that that's how their systems are wired, and they are hyper-reactive to whatever is stimulating in the environment, and they are also prone to sensory overload, so that there's a narrow window where they're comfortable emotionally, and there's a lot of volatility. The sense of self is just gets poorer over time. Conforming does not come naturally to these girls. And they can feel like imposters as they struggle to look like everyone else. They are often ashamed and avoidant, and they judge themselves harshly relative to their peers. And in fact, research even said that their peers tolerate higher levels of ADD symptoms from boys than from girls. So again, that gender appropriateness piece is part of this as well. And it is true that girls are hard on other girls who do violate those societal roles. Another thing that occurs very much with girls, and even more than boys, is somatic complaints, all sorts of body complaints, and one of them being tactile defensiveness, which is not wanting to be touched, feeling a little too sensitive, often feeling like people touch them too much or not in the way they want to be touched. And I often speak to mothers who feel terrible and rejected because their daughters don't want to be hugged or kissed, or and they push them away, or they get sort of rigid when someone tries to hug them. And it feels very personal, obviously, and very upsetting. But that is actually just a physiological sensitivity, and something, again, in the self-regulation realm that they just can't quite get comfortable with. And in fact, they're sensitive to all sorts of environmental things. They have more allergies, more asthma, more rashes, very often headaches, stomach aches, feeling nauseous in the morning. They, have a lot of trouble sleeping, and are just sensitive to sounds and intense tastes and odors, temperatures. So these are all things that they're being assaulted by their environment, but that's sort of invisible to people who have no trouble processing it. So then, you might just say something to them while they've been struggling with some discomfort in their environment, and then they may snap at you, and you won't necessarily know that their systems were dealing with an accumulation of different kinds of assaults that you might not have been aware of. The idea of external locus of control, which is the idea that things happen to them, whether it's fate or luck, rather than them feeling an internal locus of control, which is, I decide what happens to me and I can affect change in my life. And again, much more so for girls, they feel like they don't have that ability to affect change in their lives. Especially after puberty, we find that sense of internal locus of control sort of segues into an external locus of control as we move towards puberty, and that's a really upsetting thing as well. The ADD brain struggles to regulate its responses to the environment, and some impulsive brains overreact more often, and more inattentive brains tend to underreact. But regardless of which end of the continuum it veers towards, it rarely ends up with a response that's in the middle of the bell curve. So this really explains how very impulsive girls and very inattentive girls can look so very different from one another, and yet both have ADD. So I'm just going over the differences in what you might end up seeing. And I have to find that page. The inattentive girls can appear passive and not necessarily engaged, and they process information slowly, and they may have expressive or receptive language problems, but not necessarily. That's often suspected, or central auditory processing problems, which certainly can be there, but there's just a lot of internal and external distraction that makes processing go very slowly. And these girls are very fearful of humiliation and don't want to volunteer in class, and when they start to feel frustrated, they tend to shut down. They don't want to be the center of attention. Again, a problem in a classroom if you don't want to volunteer an answer because you might be wrong. And they're very rejection sensitive. So, whether or not there is rejection, they after a period of time, they start to, be really fearful of that and expect rejection. So these are the girls where the teacher will say, good student, good grades, but doesn't participate in class, and doesn't, as a result, doesn't work up to their potential. Also, they may be sort of doing okay academically, but it may just be assumed that they're just an average student, rather than the fact that there are all these other things that are making them not able to really engage in the classroom and show who they are. And on the other hand, we have the combined type girls, and these are the girls who, are the what they call the chatty ones, and their desks are always being moved in class because they're giggling and gossiping and interrupting others, and these are the things that they are identified for by teachers. They can be very precocious and sometimes come up with ideas for a group in a very charismatic way. But they are even more emotionally reactive, and there's a lot of mercurial feelings of being really silly and then really angry and then crying, a lot of drama and slamming of doors and, I hate you, and I'm sorry. And some of these girls can be a bottomless pit of and demands, and it may feel manipulative, but it's not. I mean, it's really their brains just saying that we don't have the kind of stimulation we need, want more. but that isn't necessarily how it's going to feel to you or come across. So this is just to give you an idea. You may all know about the differences of the two types. So some of the common experiences for girls is that they need limits, but they resent your supervision. They really need structure, but they resent the rules. They need reminders, but they resent the nagging. They need help self-monitoring, but they resent feeling dependent. And they're drawn to risky behaviors, but they resent the warnings. And they're drawn to addictive behaviors, but believe they're in control. And they need objective input, but they resist treatment if it's at the parent's behest. There are a lot of areas where essentially it looks like they're arguing with you, but I mean, really, as I'm saying, that they need some of those things, and part of them knows they need those things. But there's the other, more impulsive part of them that fights against it. And while it may look like the argument is between you and them, it's often between them and their brains. Unfortunately, as they start feeling worse about themselves, they do start second guessing themselves and censoring what they say. And feeling bad about themselves, and very often get into a distorted body image no matter what they look like. They compare themselves to others and are not happy with how they look. And then they become willing sometimes to accept invalidation from others, to get into unhealthy relationships in their desire to just be, in connection with somebody, that they will accept it if they are not being treated as respectfully as one would like, but at least they're being included, and that becomes a problem as well. But then what we're finding is that the risks of impulsivity create even more of a problem. Now, in their defense, it has also, research clearly shows that we've discovered that the area of the brain that is involved in impulse control in the prefrontal cortex is not fully myelinized or completely ready for action until the very late 20s. So our expectations that, a 16-year-old is going to show good judgment is, there's just some oxymoron to that idea. Since it's the last portion of their brain to fully develop, questionable judgment is sort of developmentally appropriate. But on the other hand, there was a very famous experiment in 1970, the marshmallow experiment, where 3 to 5-year-olds were given one marshmallow, and they said, if you don't touch it for 5 minutes, you'll get a second marshmallow, and they just watched kids to see what they would do. And they then followed those kids, and they have discovered that the kids who were able to inhibit their impulses and not first marshmallow have ended up having more successful lives. So it's really it's important. We're just starting to, we're just finding that out about those kids from 1970, and so we really want to understand the role that impulsivity has in interfering with one's goals, because those people had better life outcomes in all areas. So this is about problems with inhibiting behavior, stopping a behavior or a plan. They can't shift their attention quickly enough to change course. And so they tend to choose immediate gratification over long-term but larger rewards. Another thing that we've learned is about the dopamine reward center of the brain. And I mean, that's literally, an area of the brain that is seeking more dopamine, and accessible dopamine is, we believe, has a relationship to ADD symptoms. And we're finding that especially things that give an intense, quick shot of dopamine to the brain, that's particularly reinforcing. And what we're finding is that all of the things that can supply that are not necessarily things that you want to reinforce, whether it's substances, alcohol or drugs or cigarettes, or sex, or there are some good things. Competition in sports will raise dopamine, but a lot of the things that driving really fast, gambling, all these things are, and video games are incredibly reinforcing to that area of the brain. And if it does sort of ring the bell in the reward center, it's going to be reinforced and more likely to happen. So those who really have that more impulsive piece are the ones who are even, more sensitive to that happening. And so those are also the girls that require, more supervision, whether they like it or not. Because these girls are trying to seek acceptance in some way. And so very often it's in some kind of hypersocial behavior. If they can't conform to the regular rules, they can find the other kids who are all, smoking outside of the school, or getting high somewhere. And so these are some of the things that really have to be watched. They often get into early sexual behaviors and STDs and early pregnancies. So and this is also much more likely for the impulsive group, addictive behaviors and eating disorders. And very quickly about eating disorders, the ADD brain does not give the right messages about how it metabolizes glucose. So it always tells you that it needs more glucose for energy, even though it has enough glucose. So what it's telling girls with ADD is that we need something to convert into glucose, either sugar or some sort of carbs. So literally, the brain is saying, please don't eat a salad. We are not the least bit interested in salad. You really have to have, pasta or bread or, a bagel. And so girls, are drawn to these kinds of carbs, and you can be having terrible conversations about you don't want to gain weight, you don't want to eat that. But just to say that there's actually a physiological reason that they are drawn to that and not the carrots that you have already peeled for them. And so but the most important thing is we're finding that these are the girls who are most likely to act on those feelings of desperation that I was discussing earlier. So the risks for self-harm and suicidality for the girls with impulsivity were much, much higher than for inattentive girls. And, of course, those were higher than girls without ADD. One of my areas of special interest for me is the high IQ inattentive girls, because these are the girls that are least likely to ever be identified as having ADD. And I'm worried about really missing them. There's such a huge disparity between intellectual functioning, which can be like 3 years beyond their peers, and social emotional functioning in the world of ADD, developmental lags, we usually think of it as about 3 years behind their peers. So if you think about the intellectually 3 years beyond and social emotional 3 years behind, we're talking about a 6-year discrepancy between levels of functioning in a young child. That's just immense. And there's tremendous social stressors and involved with that, and it's hard for anyone to make sense of. They may be more intellectually drawn to converse with adults, but they might prefer to play with younger children, and they're going to look emotionally immature, and they're not going to feel like they really fit anywhere. In addition, they get the message that there is success that is tied to a high IQ and being successful in school, and then that becomes part of their identity, and then their shame about not succeeding is even more intense than other girls, because they're like, but I'm really smart, and I can't understand why I can't do this, and people who are not as smart are having no trouble doing this. So though they struggle with these kinds of conundrums and really don't know how to label themselves, and it's so shameful they don't really ask for help, and this is like their horrible secret. And what they do is they learn to compensate really well, but compensating masks the symptoms of ADD. They could often become perfectionistic and become like hyper-vigilant about not making a mistake, and that's it requires them to be really rigid, and they tend to spend extra hours on their homework, and it's late at night, and but they have to make sure that that their facade is intact and they look good in school. But it's exhausting, and it's exhausting to hide and fear that they'll be discovered as an imposter because they're working so hard at it, and often paralyzed by fears of humiliation. So they tend to avoid social situations, and they think that no one will really understand them. Since they're not asking for help, it's a catch-22, because they look really successful and they feel like they're succeeding, but it's at such a high cost, and no one knows the struggle that they're dealing with, and so their life continues that way, and they're living with a secret. So it's just another level of struggle on top of girls in general having ADD. So how can parents help? Some of these things, you've heard and read in magazines and books, and I'll go quickly over that, and maybe some of the things you haven't. With most of the families that I see, I never have to say, you're not doing enough for your daughter. But I often have to say, you might be doing too much. Loving, involved parents who educate themselves about ADD, and I imagine a lot of you are listening to this right now, are sensitive to their daughter's struggles and attuned to their frustrations, and they want to help them. And naturally, you want to try to insulate them from potential frustration and pain. And the issue is that it's a really challenging tightrope walk to figure out how you can protect them from overwhelming difficulties, but still allow them to build up their frustration tolerance and learn to creatively problem solve for themselves. If you intervene too often, intervention becomes part of their definition of love. not the worst thing to have as part of your definition of love, but it creates dependency at the same time. And there is an unspoken message that I do this for you because you can't really do it for yourself. And that becomes an unintended piece of their identity. So figuring out that balance is difficult, and it's really difficult because developmentally, as they change, where the tightrope is changes as well. It's not an easy road for you to walk, but the goal is to breed confidence and independence and help them solve problems with the way their brains are wired, and teach them the activities of daily living and let them enjoy the mastery of feeling competent. I just work with many young girls who then go off to college and have never done their own laundry and have never written a check and have, there's a lot, they have never, had to wake up by themselves in the morning, and there are all sorts of things that it becomes a steep learning curve. So it's teaching them these things gradually is the only way that they'll be ready to launch when the time comes. And teaching them everything that they can know about ADD and anything else that interferes with their learning, so they can advocate for themselves instead of you doing it. That's another thing that gradually needs to be transferred to them. And they should learn how their brains work and what situations are uncomfortable for them. And then I'm sure that you know about predictable routines and how teaching them how to structure things for themselves. But my strongest suggestion is to consider that the struggles that I'm sure you experience daily with your daughter, and power struggles, which feel very personal and upsetting, are not so much between you and your daughter as between her and her ADD brain. In other words, her intellectual understanding tells her one thing. Like, Mom said I should start my homework now. And she may indeed think that Mom is probably right. But then her brain says, no way, that is too boring. I couldn't care less about your homework. And math is really hard. I don't even want to do it. Let's look around and find something more stimulating. And then you find her on Instagram or in the snack cabinet, and it seems that she defied you. But the reality is, on some part of her knows she has to do her homework, but the brain is pretty powerful. And if it says, I can't focus, I will not focus on this, then it will not focus on that. So acknowledging to her that you appreciate that the struggle lies within her every moment of every day is incredibly validating. And it puts you and she on the same team. And together you're going to figure out ways to psych out her brain to get it to comply. And that can definitely be done. When I spoke with a kindergarten girl who had been chastised for standing up during circle time, she told me, I know, I told my tushy to stay on the rug, but it didn't listen to me. And I think that really captures that struggle between the person and their brain. And your sensitivity to that struggle, regardless of how intentional her behavior may appear, is something that can be really, really helpful and really, really healing for the relationship between you, which in my opinion is probably the most important thing there is. Okay, and that's the end of my prepared presentation.
Thank you, Dr. Littman. That was a wonderful presentation. Now is your opportunity to ask Dr. Littman your questions about girls with ADHD. We have received many questions during the presentation. So if we are unable to get to your question, please contact an information specialist at CHADD's National Resource Center on ADHD. This first question is from Laura, and it is a question that our information specialists receive a lot. Her daughter's doctor is saying that she may have anxiety and not ADHD. She is asking how ADHD and anxiety are related or similar.
Right, that is absolutely the most common question. And the reality is, as I was, I talked about a little bit, it is a really expectable sort of a corollary of living with ADD, that you become anxious about performing, and whether or not you're going to measure up or know what's going on or be invited as part of a group, whatever it is. Tremendous anxiety, and that anxiety is secondary to ADD as opposed to it can be a second discrete disorder, but very often it's not, but it is the most observable symptom. And so very, very, very often girls are actually taken in to diagnosed, and the symptoms that are most obvious are either anxiety symptoms or depression symptoms or both, and often they're put on an antidepressant, which really, the entire idea of the underlying ADD is not always embraced. So, but often when dealing with, treating ADD, anxiety lessens tremendously. So, it is an issue. This is the most, when I spoke right in the beginning about possible misdiagnoses, that is the most common one. And, as I said, there can be a separate anxiety disorder, but for girls, they tend to internalize these feelings of anxiety, and it becomes really the bigger struggle for them is dealing with the anxiety and the depression, but it is still secondary to the ADD, and if the ADD symptoms can be improved, the anxiety usually improves without treating it specifically.
Our next question is from Deborah. She is asking if hormone medications such as birth control pills can affect ADHD symptoms or the presentation of those symptoms. Excellent question, and the answer is absolutely. And that is something that is commonly done. I'm not a prescriber of medications, but I can say that birth control pills do even out all of the hormones across the month, and that is really successful in terms of being the emotional reactivity. Not to say that you won't be emotionally reactive, but you won't be falling prey to just the constant fluctuations and changes. So yes, that absolutely does work. The next question comes from the mother of a teenager who attends a girls-only private school. She is asking for some advice on how to prepare her daughter for when she leaves home and goes to college, and in particular for dating. Right. Because this girl is not exposed to boys that much, it is even helpful to watch movies together and discuss the kinds of behaviors that you see, because really until any girl on earth, and we have all been there, until you're in the position where you are actually seeing your body respond to basically sexual feelings that may not have been in a position to feel before, it can be an overpowering thing. And in the world of ADD and it being a problem with impulse control, it could be overwhelming. And so she has to at least be learning about that idea now, because intellectually talking about it is one thing, but then putting yourself in that position
and the desire to please and the desire to be accepted being so much more powerful in girls with ADD, they can really strongly get pulled into something. So, I think that everything that you can do now to try to familiarize her, but not terrorize her, and again, it's another tightrope walk because it is sort of it is an incomprehensible piece of hormones in terms of not only how girls' bodies work, but also how boys' hormones work. And without having had too much experience with that, that can be pretty overwhelming. But to be really cautious, there's no doubt that the number of girls that get pregnant in their first semester of college, girls that have ADD, the percentage is overwhelming compared to control girls. So it really is an issue.
Our next question is from Tara, and she asks, why is it difficult for girls with ADHD to conform to social norms and recognize social cues?
Okay, great. It's a great question. Because those behaviors require a really perfect choreography of the executive functions. In other words, you have to be able to organize yourself and sort of prioritize and plan what you're going to do and plan, what you're going to say and then make appointments and be on time and listen quietly without like tuning out or getting bored or interrupting. And then you have to be able to self-monitor and say, well, what did I do and how did they respond to it, and make small changes in your behavior. And all of those things are difficult for girls with ADD. And it's the kind of thing where sometimes you may be able to, all those skills are intact, but you can't always orchestrate them to work together when you want them to. So often, the way they think that they might respond is not the way they're going to respond. And so it ends up that even when they're determined to, they say yes to, being in some group, and that they aren't able to then comply with the demands, and girls can be pretty harsh about that. So it literally is difficult because of their neurology.
This next question is from Sasha, and she asks, what should parents know about ADHD and autism spectrum disorder in girls?
Well, I think the thing to know is that essentially it's a continuum. And these aren't really discrete disorders. They're discrete essentially because someone has to make a diagnosis and they put some boundaries around it. But the reality is that at one end of ADD, you see the girls who are moodier and maybe closer to a mood disorder. And then at the other end are the girls who are more rigid in their presentation, and those are the girls who are more and more rigid and maybe missing more social cues, are the ones closer to what we used to call Asperger's, and that now they consider that in the autistic realm. So what I would say is that it's about brain wiring, and you can see those tendencies towards one end or the other. But most of the ADD sort of falls in that middle spectrum where they're struggling with some of each, with some social problems and some regulation problems, but some girls will veer towards one or the other end of the spectrum.
Our next question is from Suzanne. Her daughter was recently diagnosed with ADHD. Suzanne is asking what type of doctor should she take her daughter to for treatment. Should she go to a psychiatrist?
Okay. Well, first of all, no, there's no reason to work with a psychiatrist unless your intention is to pursue medication. But even if you are going to pursue medication, it might be better to work with another kind of professional or other kinds of support. So this is a really important area, because finding someone who gets it, which I think was on my last slide, is really a challenge. And different training, people understand things different ways, but you want someone to be able to help and be supportive with the social aspects and the dynamics in the family, which are a really central issue. And psychologists and social workers are trained to do that. You may want someone to help with organizational issues or tutoring. There are a lot of different people who can help, but and I mean, I probably err on the side of I'm a psychologist. I think psychologists can be very well trained to do that, but I know that social workers are too, and there are psychiatrists who also specialize in ADD. And there's also a difference in cost, so there's a lot of different ways to decide, but I think it's about the person's experience with really working with ADD and really knowing what it looks like in girls, because not that many people have worked with that many girls, and that's the question that you want to be able to ask.
Our next question is from Maria. And this goes back to when you were talking about how many girls with ADHD do not like to receive hugs. She's asking if she should just allow that aversion or work with her to make her more comfortable with hugs.
Well, I think that, first of all, being able to communicate about it is an important thing. And very often what girls can do is be really specific about the kind of a touch that is okay for them, and then the kind that is just too stimulating for them, even though it might not be for other people. So it's great to be able to respect what they're asking, or to even talk about other ways that sort of you can express affection that would be okay. Since this is a physiological response, that isn't something that they have control over. Really change very much. I mean, a lot of people do learn to tolerate it because it's socially acceptable, but they're often uncomfortable. So I think the best thing to do is to find out what will work for them. And because they do want affection, and so that it's really it can be a very poignant problem, because people on both sides are feeling like they want greater intimacy. It's sort of the language that has to be worked out that will work between the two of them.
The next question is from Paula. Her question is, are girls with ADHD more prone to exercise than the amount recommended to be healthy?
Yes, it's absolutely. In fact, when I was talking about addictive behaviors and increasing dopamine in the brain, there's definitely a group of girls for whom exercise gives them a sense of control, and that becomes can raise their dopamine and be reinforcing, and they can really like that is what they want to do, and that's the one thing that they want to do where they feel in control and they and successful. And so on some level you can understand what attracts them to it, and to some extent it is healthy or healthier than some of the other like an eating disorder, although often those girls who exercise can sometimes get into restricting their food in a somewhat anorexic way. So it's about that rigidity, and when they become rigid about any one of these behaviors and move towards sort of addictive in terms of what it does for their brains, it's a cause for concern. So yes, that is another way that very often that girls will express this this need to raise their dopamine, but it also has its downsides too.
Our next question comes from Raven. She has a 14-year-old daughter, and she denies the diagnosis and does not want any help. What can Raven do to help her daughter?
And what I suggest to people is that there is very little reason to actually label ADD. The main reason to really give it a label is if you need to get accommodations in school and they require a diagnosis that has a name. Otherwise, I think it's far preferable to describe ADD and rather describe here are the things that are easy for you, and here are the things that are more difficult for you. And then, here's your friend, and these are the things that are easier for her and more difficult for her, so that, this is easier for you, this is hard for her. And to just understand their own strengths and weaknesses, and to understand, okay, don't like going into a big department store or a huge party because that's really overwhelming, and you prefer talking to someone, one-on-one, whatever it is, helping them be able to identify what's comfortable for their brain and what's hard for their brain. Without labeling it as a disorder, and it's getting to know themselves and how they can best work with their brain is whether it has a label or not. That's what you're going to learn to do, since we can't change the wiring. If it's done in a sort of, I think that tends to make girls less defensive, because since conformity and peer relationships are everything, the idea of being identified as different, even though they feel different, it's the last thing they want to hear. So if they want to know that everybody struggles with something, and that this is just something that's harder for you, and I'll help you learn to deal with it. And at some point in the future, that they may feel less defensive and more like they want to hear about it. But that's often the best way in, is that I've found.
This next question is from Deborah. She is asking whether medications that treat ADHD affect boys and girls differently.
Well, actually, the answer is yes, and a lot of this is very basis of current research, but we are finding that even stimulants, which were thought to be function pretty much the same every day for everyone, that because of the interaction with estrogen, stimulants don't work as well when there's very low estrogen levels in like that week before your period. And there are very few doctors who get this, but some actually will slightly raise the level during that week in order to accommodate that. We talked about the birth control pills as another way of managing that, and that the fact that girls and women in general tend to, because there's so many internalized psychological issues of anxiety and depression that we talked about, they are often on some combination of a stimulant and maybe some sort of SSRI or Wellbutrin or something like that. Again, I don't prescribe, but I that often those secondary symptoms need some sort of treatment, not always. But I think that you see that combination much more often in girls.
And this is our last question, and it comes from Tammy. She is asking, when does it get better?
What I do in my practice, and that this is basically what we can change. We can't change brain wiring, but we can change what you see when you look out your window. In other words, your view of yourself relative to the world. So it's about an acceptance of the self, and there's a lot of great things about, there is disagreement about this, but ADD people often have strengths in terms of interesting and sort of a novel vision of things. I mean, a lot of, artists and musicians and inventors and entrepreneurs have ADD because they're willing to, or their brains insist on them thinking outside of the box. And basically it's about embracing the fact that this is how your brain works, and these are the creative solutions that you come up with, and that you march to a different drummer, and that's not a bad thing, and conforming is not necessary or healthy. And to remember that well-behaved women seldom make history. That's a quote that's out there, and that to sort of accept they are, rather than hiding and feeling that they need to adjust it for other people, and that because it's those feelings of shame and demoralization and feeling not good enough that are the things that make girls end up with the negative outcomes that I talked about. So it's really about creating a sense of self that where they feel good about themselves. In fact, there's research that says that one of the best things that you can do is to instill in girls a belief that they can succeed in school, that is a really valuable thing. So that's not at all like you can get them the best tutors and make sure that they get the highest scores, but it's about them believing that they have the potential to be able to do what they want to do. And again, that is really research supporting that idea that if you feel confident that you can have an impact in the world and it can be on your own terms, that's about as good as it gets. And ADD will not stand in the way of that.
This concludes our Ask the Expert webinar. Thank you, Dr. Littman, for sharing your expertise.